You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Today we're going to talk about a common test that is performed in offices and homes all across the United States and the rest of the world. This test is performed at least 5 to 6 million times a day. Sometimes people believe the results, sometimes they don't, sometimes they repeat it multiple days in a row, and sometimes they'll come to the hospital because they still don't believe it and they want some type of confirmation. The test that I want to talk about today is the pregnancy test. Now, why would I want to talk about a pregnancy test? It seems like a very simple topic. Well, the truth is there's a lot of confusion. So some people believe in the test, meaning it has certain value. Others look at the result and don't believe it. They're looking for a different explanation. And so in the emergency room where I work every day, I see 2 or 3 or more women or their families who come in insisting on repeating the pregnancy test or doing some other testing to confirm whether that woman is pregnant or not. And I understand there's a lot of emotion, there's a lot of fear, some anxiety that goes into it, whether it's positive or negative, and so people are looking for validation. So I thought today would be a good opportunity for me just to give an overview of what a pregnancy test actually is and how it can help you and your doctor guide you on the next steps. Now, the first thing we have to define is what a pregnancy test actually is. So a pregnancy test is based on a chemical. That chemical is called HCG. HCG is an abbreviation for human chorionic gonadotropin. So that's a very long term. That's why we call it HCG. Now, HCG is actually produced in a pregnant woman's body where the embryo and the uterus have an interaction. What that means is as the developing embryo gets larger, the amount of HCG will increase. At some point, the HCG increases to such a point that it's in the blood and it spills over into the urine. So in general, when a woman does a home urine pregnancy test where she provides a urine sample onto a stick at home, it has to have a certain amount of HCG in order for it to actually be detected. That's why all of the over-the-counter home urine pregnancy tests have a minimum duration. What that means is you have to miss the period and then a few days after that in order for it to be accurate. So if a woman has not even missed her period yet, maybe she's 2 weeks or 3 weeks into her month, and she does a urine pregnancy test, it's not going to be accurate because there's really not an eventful action that has occurred to allow the HCG to be high enough. It's almost like trying to measure something in a cup. If the cup isn't even full, you can't measure it accurately. It has to actually get to the top of the cup and spill over before you can actually say, yes, we have enough volume to work with. Now, there are different companies that make different types of pregnancy tests. Some of them promise certain things, meaning they promise that they can detect it on the first day of conception or the 10th day of conception or the 30th day of conception, and that's all proprietary. What that means is that their corporation, their laboratory, has a patent, they have a way of detecting it, and on the back of that package, it'll tell you how accurate it should be. However, none of them are 100% accurate. It's not possible. So there's always a 2 or 3% false negative or false positive. Meaning you can do a pregnancy test when you're pregnant and it could say that you're not pregnant or vice versa. And that's usually when people come into the ER or they see their doctor because they may be having other symptoms. They may be having pain. They may be having bleeding. They may be having discharge, or they may just be worried and they want to get a second opinion. So the pregnancy test at home is generally very accurate, but you have to do it at the right time. Now, once a woman has missed her period and she's, let's say, 2 months or 3 months into her pregnancy, those are going to be extremely accurate because the amount of HCG is in the 1,000. It's a very, very high number. So that is going to immediately turn positive. The dilemma is when women have irregular periods. They can't say for sure, was that the first day of my cycle? Was that spotting? Was it something else? And that's where people get confused because they have to go backwards in order to calculate when their period was and when they should actually be testing for it. And that's why some people come in to get that clarified. Now, the HCG is also measured in the blood, which is the test that we do in the hospital when there's a confusion situation or when we have urgency that this patient needs to go to surgery or there's a complication. So let me explain. So the HCG, again, is a value. It's created by the developing embryo and it increases. There's actually charts that tell us when it will double, triple, and increase. We have charts and measurements that are validated by research. So a doctor can order a serum HCG, which is a blood test, the same test for the urine, but it's much, much more accurate because instead of a positive or negative result, you're going to get the actual value. So for example, if we draw the blood, a woman says she missed her period about 6 weeks ago, we might expect the HCG to be about 5,000. Now, if she says that she missed her period 3 months ago and that value is only 5,000, then we have a problem because that means either the baby is not developing or that baby has already died, there's been a miscarriage or a threatened abortion, and so it's no longer multiplying, it's no longer creating HCG, and that value will actually start to go down. And that's the other indication when we order a pregnancy test from the serum is that it gives us a snapshot, what is the value today, if that woman has vaginal bleeding, if she's had a car accident, if she's had some medication, something that could have affected the pregnancy. We have to know what's happening over the next few days. So in the ER, when I order this test, I write it down, meaning the number of the HCG, and I print off a copy. We'll also do an ultrasound because we can correlate if the woman is supposed to be about 6 weeks pregnant or 8 weeks pregnant, and we do an ultrasound and the dates match up, then we're confident. We have confirmation of her accurate pregnancy dates. However, if there's a discrepancy, for example, if the woman is supposed to be 3 months pregnant, but the baby is looking much, much smaller, then we have to go back and decide which one is more accurate, the ultrasound, the HCG, the woman, or something else. And that's usually where we need follow-up by the gynecologist. So the HCG, once I write it down in the ER, I tell them you need to call your doctor, make an appointment over the next couple of days, have your value repeated. If your HCG continues to increase as expected, that means your pregnancy is doing well, your baby will survive. However, if those numbers stagnate or drop, then unfortunately that woman has had a miscarriage. The pregnancy will terminate, and we have to always give the bad news that she will have a spontaneous abortion or miscarriage in the coming few days or weeks, and that she will need to see a gynecologist to make sure the HCG trends all the way down to 0. Now, there's one other situation where we use an HCG for pregnant women, and that would be a tubal pregnancy, also called an ectopic pregnancy. In this situation, a woman is pregnant. She's calculated that she is supposed to be 6 weeks or 8 weeks pregnant. She has her period dates and everything validated. When we do the ultrasound, we don't see the baby in the uterus. The baby is in the tube, meaning it's ectopic. That is a life-threatening situation. That pregnancy cannot continue because the baby has no room. There's no space in the fallopian tube for that child to grow. And if there's bleeding or infection or a blood clot, then the mother can also die. And that would be a very, very serious complication. So unfortunately, in that situation, as doctors, we have to prescribe medication to terminate the pregnancy for the sake of the mother. So that would be a medical type of an abortion. Usually there's medications like methotrexate and a few other options that are available, but that pregnancy has to be terminated because it simply cannot continue. In that situation, again, the same thing. We do an HCG serum, so we have a value, maybe it's 5,000 or 6,000, and then after a few days of taking the medication that causes the pregnancy to end, they'll repeat the HCG and it should be dropping at that point. Now, there are some other situations where the HCG may turn positive that have nothing to do with pregnancy, and those are actually related to certain types of cancer and other gonadotropin-related complications. In those situations, if the HCG is positive, but the ultrasound doesn't show a pregnancy, or if the person is a man, then we have a problem. Those people will be referred to a specialist, and they have to be screened for certain types of cancers, as well as other testing, because that HCG is coming from some source. If it's a hormone that's being produced by a tumor in the body, that tumor has to be identified and removed. There are possibly some medications that can also make the HCG turn positive. So that would include things like testosterone and other types of hormones. There are people who use HCG as a diet pill. They actually believe that it helps them to suppress their appetite. So there are situations where you have a false positive HCG, and that's where we have to be very careful with the history, make sure we're not overlooking anything. So I hope you learned a little bit about the pregnancy tests and how we calculate, measure, and why we do the tests that we do. I do want you to have faith in the over-the-counter available urine pregnancy tests, but if there's any confusion, talk to your family doctor or your gynecologist to get a serum HCG, do a follow-up ultrasound, and then keep your appointments just so that you and your pregnancy remain healthy. If you have other information about your experiences with the HCG or other pregnancy tests, please share them with us online. We have a very active Twitter page. You can send us information, and I'll be sure to share it with our followers as well. Thank you so much for joining me on today's episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3&0 Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.